How you guys doing? Mike Hartman. Today I'm going to be talking about traumatic brain injury. So traumatic brain injuries are jolts to the head or to the body, or penetration of an object into the brain's tissue that impedes brain's normal function. In 2014, there were 2.87 million hospitalizations for traumatic brain injury. So unfortunately, it's a major problem that needs to be addressed as soon as possible. The most common causes for traumatic brain injury, the leading cause for traumatic brain injury emergency room visits in 2014 was falls. They occur primarily in pediatrics and geriatrics and account for 48% of those visits. The second leading cause of traumatic brain injury emergency room visits in 2014 was 20% coming from vehicle-related collisions. The third leading cause was violence, which includes gunshot, domestic violence, child abuse, and specifically shaken baby syndrome is listed, which occurs when an infant who is still developing is shaken violently and it jars the brain and affects cognitive development throughout the lifespan. Sports injuries also can cause traumatic brain injury. Cycling has the highest incidence, but nearly every sport has some sort of risk for traumatic brain injury. Boxing and mixed martial arts are also very high in the incidence rate of traumatic brain injury. Explosive blasts and combat injuries, grenades and shrapnel can penetrate, but also those who are just within the vicinity of an explosive blast where the wave of pressure is able to course through them. The belief is that the wave of pressure goes through the brain and temporarily affects the brain's neural function. And finally, intentional self-harm, unfortunately, is the leading cause of traumatic brain injury-related deaths in 2014. 33% of those deaths came from intentional self-harm. So, risk factors for traumatic brain injury. In general, traumatic brain injuries are most common in geriatrics and pediatrics. Both traumatic brain injury-related death and hospitalization rates were highest for persons 75 years and older, and children ages 0 to 4 had the second highest rate of hospitalization. Those two groups make up the most common type of traumatic brain injury or cause of traumatic brain injury, which is falls. So there are levels of traumatic brain injury, and their symptoms will be described in the slide. The Glasgow Coma Scale was developed in order to measure the severity of brain injuries, and diagnosis is also based on symptoms. So mild traumatic brain injury has a Glasgow Coma Scale of score 13 to 15. 15 is the lowest score on the scale. That is usually accompanied with symptoms of brief or no loss of consciousness. Scans of the brain and tests on the brain appear normal. It's only diagnosed when there's a change in the mental status of the brain. So typically there's a baseline test that is done for an athlete or for an average person, and then the test is given again following the injury so that we're able to diagnose that mild traumatic brain injury. The most common type of that injury is concussion. Moderate traumatic brain injury has a Glasgow Coma Scale of 9 to 12. So that is accompanied by loss of consciousness that lasts a few minutes to a few hours. Confusion can last a few days to a few weeks, and physical, cognitive, behavioral impairments last for months or can be permanent if not treated correctly or if severe enough. Severe brain injury has the Glasgow Coma Scale score of 3 to 8, 3 being the most severe score that can be given on the Glasgow Coma Scale. They're accompanied by a crush, rip, and shear of the brain tissue. They are the most life-threatening brain injury by far. Drastic measures are needed to treat these injuries and in order to keep the person alive, and oftentimes it can affect thinking, sensation, language, emotion. It can cause epilepsy throughout the life, and it causes an increased risk of Alzheimer's and Parkinson's diseases. These injuries always require a extended hospital stay and extensive rehabilitation cognitively and physically, and unfortunately they can be fatal. So for exercise response to traumatic brain injury, peak aerobic capacities are typically 65 to 74% of normative values. Compared to the non-injured sedentary persons, the VO2 values are reduced by 25 to 30%. Aerobic capacities are reduced significantly, and unfortunately can even lead to the uncoupling of the autonomic nervous system and the heart. So both a cardiologist and a neurologist should be consulted before exercise is carried out to ensure that the rhythm between the two are still as they should be. So the effect of exercise following traumatic brain injury. Traumatic brain injury can lead to a loss of motor control and inability to exercise if it's too severe, unfortunately. However, if they are capable of exercise, it has been proven that exercise is highly beneficial in rehabilitation from traumatic brain injury. So a study by Drs. Griesbach, Hovda, and Pinella found that voluntary exercise upregulates brain-derived neurotrophic factor, which is illustrated down in the corner there. And that brain-derived neurotrophic factor is associated with an enhancement of cognitive recovery after traumatic brain injury. The American Physical Therapy Association recommends resistance exercise and rehabilitation at 60 to 90% of the maximal heart rate for 20 to 40 minutes, 3 to 4 times per week. And as they grow stronger and as they develop, that can be increased. So for medications for the treatment of traumatic brain injury, anticonvulsant medications are used. They're used to avoid seizures, but they can cause dizziness, blurred vision, and can affect the balance and depth perception during exercise. We need to make sure that we monitor them, make sure that they're balanced properly, and have spotters whenever doing weighted exercises. Antidepressant medications are used mainly to treat anxiety and depression that can come along with the injury. They can cause blurred vision, dizziness, and seizures. So you have to monitor them very closely to make sure that if they are epileptic, that we have the means to get them to a health professional as soon as possible. Antipsychotic medications are mainly used to treat aggression, sleep disturbances, and schizophrenia, but they can cause blurred vision, dizziness, and hypotension. So blood pressure must be closely monitored in all traumatic brain injury clients, but specifically in those who are taking antipsychotic medications to make sure that we aren't having hypotension occur. Pain management medications are mainly used to combat arthralgia, which is joint pain, and myalgia, which is muscle pain. They can cause dizziness, nausea, and vomiting, so we have to make sure we keep the client properly hydrated and nourished before, during, and after the exercise in order to make sure that we can avoid those symptoms as much as possible. Motor system medications are used to prevent muscle spasms, but they can cause cramps, muscle weakness, and dyskinesia. We have to monitor the intensity differently and lessen the workload if necessary. The intensity may actually change for them where they perceive it as much more difficult than it was based on their baseline tests, just simply because these medications are making them weaker. So we have to monitor and make sure we lessen them to a point where they're still making progress but are not working harder than their body is capable of. Finally, memory and cognition medications are used to treat Alzheimer's, memory problems, and attention problems that can come from the injury, but they can cause cramps, nausea, diarrhea, and vomiting. So again, hydration and nutrition are going to be crucial before, during, and after exercise for those clients. For our case study, Joe is a 65-year-old male who had a fall 2 weeks ago that led to a moderate traumatic brain injury. He lost consciousness for 2 minutes, but his wife called the ambulance immediately and he was treated properly. He is asymptomatic apart from muscular weakness and poor VO2 ratings compared to where he was prior to the injury. So he falls within that 65 to 74% of his normal VO2 values. And his resting heart rate is 75 beats per minute, and his blood pressure is 122/80. He has been weaned off his anticonvulsant medication and is not currently taking any other medications. So fortunately for us, I'll move this so you can read the whole thing. Fortunately for us, the medications is something that we won't have to worry about, but he is recovering from a moderate traumatic brain injury, so he has to be treated as all traumatic brain injury victims are treated according to the APTA regulations. He says that his goal is to get back to his normal everyday routine, which is tending to his garden, mowing his lawn, shopping for groceries, and playing with his grandchildren. He first has to be cleared by a neurologist and cardiologist. In this case, he has done so, and he's completed his exercise test, which will be listed on the next slide, and that yielded a maximum heart rate of 150 and a maximum blood pressure of 136/84. So we are ready to go with exercise for Joe, and it seems that he's progressing very well from his injury so far. His exercise test, we want to find out what his VO2 levels are so we can determine if exercise is safe, and we can also determine what the intensity of the exercise should be. So in order to determine the VO2 levels, we're going to carry out a Bruce treadmill test with Joe under close supervision by myself, his cardiologist, and his neurologist, along with people spotting him and everything to make sure that he's as safe as he possibly can be. For exercise prescription, the recommended exercise prescription from the American Physical Therapy Association is listed below. Joe complete aerobic training 3 days a week at 60% of his heart rate reserve, which is 93 beats per minute, for 20 minutes. And each week we're going to increase the intensity 5% and increase the duration 5 minutes every other week. Each day is going to be different to keep him interested. So Monday will be walking, Wednesday will be cycling, Friday will be elliptical. As he's training, I'm going to converse with him so that as his body's stressed, we can also make sure that the mind naturally becomes less focused. But if we can harness that and keep those two working hard together, then his progression is going to go much better than it would if we just had him exercise without using his brain simultaneously and multitasking. So his resistance training is going to be done 3 days a week, Monday, Wednesday, and Friday. We're going to use TheraBands mainly, and then eventually we'll move on to resistance machines and free weights. He's going to do 3 sets of 10 repetitions, and the intensity is going to be done at 60% of his heart rate again. Typically, resistance training is measured based on percentage of 1 rep maxes or based on the weights that they're lifting. But for Joe, because he's recovering from the traumatic brain injury and we want to make sure that his cardiovascular system is functioning properly, we're going to base our intensities off of his heart rate reserve, and his blood pressure will be recorded after every set to make sure that his cardiovascular system is functioning properly. Flexibility training will be completed 2 days a week, and the American Physical Therapy Association recommends Tai Chi and yoga specifically. So he will be doing a Tuesday Tai Chi session for 30 minutes and a Thursday yoga session for 30 minutes. And his heart rate and blood pressure will be recorded every 10 minutes just to ensure that there's nothing going on that could affect his cardiovascular system and the blood flow throughout his body and specifically to his brain. So modifications and special recommendations. As I said, we will converse with Joe throughout the exercise to make sure that he is being stimulated not only physically but also cognitively. He's going to wear a helmet as he exercises, specifically these first couple weeks. Although it may be embarrassing, most of the people in the inpatient rehab are going to be wearing helmets also. And we want to make sure that he doesn't fall and hit his head again, because if he falls and hits his head again, it is exponentially worse than it would be for a healthy individual. His blood pressure and heart rate are going to be closely observed to make sure that his autonomic nervous system and heart are communicating properly, and he will not lose consciousness, which could be very detrimental to his brain tissue that is currently recovering. Joe's always going to have a spotter. As I said, a fall in his condition could be detrimental and could hurt him very badly. In conclusion, our brains are amazing things. We really need to protect them as much as we can and take care of them and rehabilitate them as best we can. I love this quote from Rocky. It is not about how many times you get knocked down, it's about how many times you get back up. So unfortunately, these injuries occur, and they're something that you can't really help most of the time. So it's not really about being injured, it's about rehabbing it the right way, getting back on the right track, and getting back to your normal life as best as you can. Typically, with mild and moderate traumatic brain injuries, you are able to get back to your normal life if you rehabilitate the right way and get that brain as healthy as you can. The mind and the body are one and the same, so the brain and the body rely on each other. Rehabbing the bodies is important as rehabbing the mind, and specifically rehabbing those two together. The communication between the brain and the body throughout the nervous system is something that you have to focus on as you rehab, not only from brain injury, but from anything, and even if you're a healthy individual. Exercise truly is medicine, so you have to make sure that you're exercising to keep that mind as healthy as you can. And finally, here am I, we're excited. Thank you guys for listening. I really appreciate it. Have a good day, guys.